Cancer is a scary term. But every day, new study is done, and our understanding of this fatal illness grows. Cancer is a disease when your cells proliferate uncontrollably and begin to spread to other parts of your body. Cancer can develop anywhere in the body and comes in over 100 different forms. Cancer is always named for the place where it initially manifests because it can take so many distinct forms. Cancer that moves from the esophagus to the liver is never referred to as liver cancer. Instead, it is called esophageal cancer. Thus, we'll talk about the telltale signs and symptoms of esophageal cancer in today's video. Now let's get going. Relax. One kind of cancer that arises in the esophagus, a long, hollow tube that joins your throat and stomach, is called esophageal cancer. Food is moved from the back of your throat to your stomach for digestion with the help of your esophagus. Everywhere throughout the esophagus is susceptible to esophageal cancer. More males than women are affected by esophageal cancer. Cancer typically arises in the cells lining the inside of the esophagus. There are multiple layers of tissue that make up the esophagus wall, including connective tissue, muscle, and mucous membrane. Esophageal cancer starts on the inner lining of the esophagus and progresses through the other layers as it grows. Esophageal cancer is the sixth most common cause of cancer-related deaths worldwide, according to studies. The incidence rates vary between different geographic locations. Pause. Let's examine the causes of this terrible disease before learning about the symptoms and indicators and how to tell whether we have it. Reasons. It is unknown what specifically causes esophageal cancer. When cells in the esophagus have genetic alterations, or mutations, it can lead to esophageal cancer. The alterations lead to uncontrollably growing and dividing cells. The abnormal cells in the esophagus build up to develop a tumor that can spread to other parts of the body and invade adjacent structures. Nonetheless, they discovered risk factors including the following that raise the possibility of development. Use of tobacco products. This covers both smoking and using smokeless tobacco. Use of tobacco. Obesity. Being obese or overweight increases the risk of esophageal inflammation, which can result in cancer. Being overweight. Alcoholism. The risk of esophageal cancer is increased by heavy or chronic alcohol consumption. Alcohol abuse. Barrett's esophagus and chronic acid reflux. Untreated chronic acid reflux can lead to a change in the cells at the base of your esophagus, known as Barrett's esophagus and chronic acid reflux. Gastroesophageal reflux disease and esophageal cancer have a strong and probably causal link. Even in those who do not have Barrett's esophagus, people with chronic heartburn are more likely to develop esophageal cancer. Additional illnesses. Several uncommon and hereditary illnesses have been connected to esophageal cancer. Other illnesses. One is achalasia, an uncommon illness that causes difficulty swallowing. Another condition that results in extra skin growing on the palms of your hands and the soles of your feet is tylosis. Esophageal cancer is more common in people with a history of head or neck cancer. Occupational exposure to particular chemicals. People who work for a long period in jobs that include exposure to dry cleaning solvents, carpenters, electricians, bartenders, miners, shotgunners, stonecutters, and sculptors are more likely to get esophageal cancer. Radiation or heated liquids. It has been noted that esophageal cancer can also arise from a regular habit of consuming hot or radiation-containing drinks, or from receiving radiation therapy to the chest or upper abdomen. Relax. Multiple forms of esophageal cancer may exist. Numerous esophageal cancer types. There are various varieties of cancer of the esophagus. The type of cells involved in esophageal cancer determines the classification. Your esophageal cancer type will determine your treatment options. Adenocarcinoma. The cells of the esophageal mucus-secreting glands are where adenocarcinoma starts. Adenocarcinoma. Most often, adenocarcinoma arises in the lower esophagus. Adenocarcinoma is the most prevalent type of esophageal cancer in the U.S., affecting mostly white men. Squamous cell carcinoma. Squamous cell carcinoma is a type of cancer. A squamous cell tumor. The thin, flat cells that border the esophagus surface are called squamous cells. Squamous cell carcinoma is the most prevalent kind of esophageal cancer worldwide, primarily affecting the upper and middle esophagus. Other unusual varieties. These are categorized as uncommon forms of esophageal cancer and include choriocarcinoma, small cell carcinoma, sarcoma, lymphoma, melanoma, and other uncommon types. Would you like to strengthen your immune system? Give Sambucus elderberry immune support some thought. This product offers high-potency forms of C and D, as well as a great supply of zinc, to help maintain your immune system on a daily basis. With a dose size of 3,200 milligrams, Sambucus gummies provide a very concentrated black elderberry extract. Antioxidants called anthocyanins are found naturally in elderberries. Free radicals are aided in their neutralization by antioxidants. For millennia, elderberries have been utilized as an immune system enhancer. To feel your best, you could incorporate them into your everyday routine. Relax. Manifestations and indices. Symptoms and indications. Let's now discuss the indications and symptoms that individuals with esophageal cancer may encounter. A symptom is anything that can only be recognized and described by the individual who is experiencing it, such as pain, nausea, or weariness. A symptom is something, such as fever, rash, or increased pulse, that other people can identify and measure. When combined, signs and symptoms might aid in the description of a medical issue. Having trouble swallowing. Swallowing challenges. Dysphagia is the most important symptom experienced by people with esophageal cancer. A popular medical term for difficulty swallowing and associated pain during eating, especially when consuming raw vegetables, bread, meat, or any hard or dry substance, is dysphagia. The tumor may eventually block the passage to the stomach as it grows. Swallowing can be challenging even with liquids. Your symptoms will progressively get worse as the cancer grows and your esophagus narrows, causing more pain when swallowing. Prolonged chest pain. Persistent ache in the chest. If you suffer from gastroesophageal reflux disease, GERD, or chronic heartburn, you are already accustomed to the intense pain in the middle of your chest. That excruciating feeling can become more apparent as esophageal cancer progresses. According to studies, the most typical symptom is chest discomfort, which can be challenging for medical professionals to distinguish from cardiac pain due to their similarity. Chest pain may arise moments after swallowing due to esophageal cancer when food or liquids lodge at the location of the tumor in the esophagus. In addition to heartburn or indigestion, some individuals have reported experiencing chest pressure or a burning sensation. Relax. Reduced weight. Loss of weight. 50% of patients with esophageal cancer experience inexplicable weight loss. This could happen if you lose your appetite from cancer or eat less because of swallowing difficulties. However, between 60% and 85% of patients with esophageal cancer may lose weight prior to surgery when the illness progresses and reaches a later stage. The most common causes of weight loss include systemic inflammation, mental health conditions, decreased oral intake, and dysphagia. Coughing fits or prolonged hoarseness. Either persistent coughing or hoarseness. A chronic cough or a scratchy, hoarse voice could potentially be signs of esophageal cancer. Vocal cord paralysis can result from an esophageal tumor that grows and damages laryngeal nerves, disrupting brain impulses that pass to the voice box. Occasionally, a condition known as laryngeal nerve palsy might result in the vocal cord nerves completely failing. Hoarseness is a common symptom of locally advanced thoracic esophageal squamous cell carcinoma, ESCC. This condition is brought on by palsy of the recurrent laryngeal nerve, which can be brought on by original tumors or nodal metastasis along the nerve. It's possible that many esophageal cancer patients don't show any of the symptoms and indicators we just discussed. Alternatively, the warning signs or symptoms can relate to a medical disease other than cancer. In the event that cancer is found, symptom management is essential to care and therapy. This is referred to as supportive or palliative care. It usually starts soon after diagnosis and lasts the entire course of treatment. Relax. How, therefore, is esophageal cancer identified? How is a cancer of the esophagus diagnosed? Some of the common symptoms we just covered may be related to esophageal cancer. In order to identify the cause of your symptoms, your doctor will perform tests and examinations in addition to asking you health-related questions if any of these symptoms don't go away. Now, let's review some of the most popular tests that are utilized to diagnose this terrible illness. Swallow barium. Swallow barium. In certain cases, this is the initial examination given to individuals who have trouble swallowing. It's a set of X-rays obtained after ingesting barium, which looks as a thick, chalky liquid on scans. Any lumps on the inner lining of the esophagus are seen on the X-ray. Due to its ability to clearly display the imaging characteristics of esophageal cancer, barium meal radiography is a dependable imaging approach for preoperative diagnosis. Upper endoscopy. Upper endoscopy. This test involves inserting a thin, flexible tube into your mouth, passing it down your esophagus and stomach, and then using a tiny light and video camera on the end. A tiny sample of tissue can be taken via the tube and examined for malignancy if there are any questionable areas. The depth of malignancy infiltration can be assessed with endoscopic ultrasonography, EUS. Endoscopic surveillance of Barrett's esophagus has emerged as a key component of esophageal cancer care. Relax. CT scan. CT scan. This is frequently referred to as a CAT scan. It looks like an X-ray, but with higher resolution photos. This can show where the esophageal cancer is and whether it has spread. Additionally, CT scans can help with a biopsy. The optimal course of treatment for these individuals can be determined in part by using imaging techniques such as positron emission tomography, generally referred to as CT scans or computerized tomography, which offer vital information regarding the local scope and possible spread of the disease. It also aids in the investigation of esophageal cancer in order to improve the evaluation procedure. MRI scan, magnetic resonance imaging. MRI scans, as opposed to X-rays, produce detailed images using radio waves and strong magnets. It can be used by medical professionals to ascertain whether enlarged lymph nodes in the vicinity signify that cancer has spread there. Esophageal cancer can be identified by MRI with a high sensitivity and a low specificity. This method shows potential for determining the effectiveness of neoadjuvant therapy and pinpointing locally advanced illnesses for trimodality care. PET scans, animal imaging. PET scans employ a particular kind of sugar that is visible through a specialized camera within your body. This sugar indicates hot spots, where cancer is present, if any. It may be useful in figuring out whether cancer has spread. PET imaging has limited uses, including the T-staging of esophageal cancer and the identification of metastasis to locoregional lymph nodes. On the other hand, metastatic disease that may not be visible using other methods can now be diagnosed thanks to PET scans. PET scans have not demonstrated encouraging findings for assessing the therapeutic response in the main tumor in a specific patient. Relax. Examine. Examine. A biopsy involves the removal of a little sample of tissue from the cancerous area by the medical professional. The only way to find out if you have cancer is to have a biopsy. Targeted biopsies can be performed on certain locations to validate the endoscopist's diagnosis. Because mucosal biopsies have a 96% sensitivity rate in identifying esophageal cancer when numerous samples are obtained. When esophageal cancer is detected, an endoscope and biopsy are typically conducted in tandem. Testing for genes and proteins. Tests for genes and proteins. It is possible to test cancer cells from biopsy tissue for genes or proteins such as MSI, PDL1, MMR, and HER2. Your doctor can decide whether to recommend immunotherapy or targeted therapy based on the genes or proteins that are present in your cancer. Researchers have carried out a comprehensive study on the molecular alterations associated with esophageal cancer. Moreover, exome and whole genome sequencing techniques have revealed specific recurrent genetic events that are esophageal cancer drivers and have demonstrated the complexity of the genetic abnormalities. The results of this investigation showed that this particular cancer kind had a high frequency of mutations, second only to melanoma and lung cancer. This important discovery suggests that these tumors are caused by and exposed to a variety of damaging chemicals, with the unique environment created by chronic inflammation and stomach reflux also contributing to their development. Relax. Illnesses like cancer can be prevented with a healthy diet and by taking supplements of vitamins, minerals, and other nutrients. Let's continue the discussion with a couple more cancer-related videos. Should we? View. The top 7 deadliest cancers or the 8 often ignored common cancer signs. Feel free to click one. Better yet, watch both films to get more information about cancer. Were there any symptoms that surprised you? Tell us in the comments section below.